Let's see, the first item for consideration is House File 1600. Members, this bill is going to be laid over for possible inclusion in our Human Services Finance Bill. And Representative Ryer, the bill is before us. Welcome to the committee. Please tell us about House File 1600. And it looks like we have 3 testifiers on the list.
Thank you, Madam Chair. I think we have 2 testifiers and 1 for questions, though that I may be out of date. So
okay,
we'll go with the flow.
Go ahead, Representative Ryer.
Thank you, Madam Chair and committee members. I appreciate the opportunity to be here again and to introduce House File 1600. House File 1600 is a straightforward bill. It requests $6 million of annual increase to the base funding for Adult Mental Health Initiative, or AMHI grants. AMHIs are regional collaboratives that work to build effective community-based mental health services and funding throughout the state. These initiatives were started as pilot projects after the closure of regional treatment centers in the early 1990s. At that point, the state encouraged counties and tribes to develop partnerships to plan for and deliver acute care and community-based mental health treatment for individuals who had been served by the state hospitals. AMHIs are rooted in bringing individuals with lived experience with mental illness together with providers, counties, tribes, managed care organizations, and DHS to fully utilize all available resources to uniquely meet regional needs. I don't need to tell this committee more about how this pandemic has affected the mental health of Minnesotans. That's why now is an appropriate time to consider increasing these important dollars that can be deployed regionally to respond to unique needs. With me today, I have Emily Shug, Deputy Director for Dakota County Social Services, and Lori Long from Stearns County. Thank you.
Thank you, Representative Ryer. Let's go to our first testifier, Ms. Shug. Welcome to the committee. Please introduce yourself and proceed with your testimony.
Thank you, Chair and committee members. Good morning. I'm Emily Shug, a Deputy Director of Social Services with Dakota County, and I'm pleased to be here on behalf of the Minnesota Association of County Social Services Administrators, the Association of Minnesota Counties, and the Minnesota Inter-County Association, MICA. Thank you for this opportunity to testify in support of House File 1600, and thanks to Representative Ryer for authorizing this very important legislation. This bill proposes an increase to the base allocation for adult mental health initiatives, or AMHI grants. And as Representative Ryer said, as we continue to respond to and recover from the COVID pandemic, now is a critical time to invest in our mental health system, and specifically in the counties and the adult mental health initiatives whose role it is to ensure that we have a locally available, affordable, and accessible network of services. So again, the need is great right now, and as you all know from what you're seeing, reading, experiencing, and hearing from your constituents, the need is growing and it is large. The pandemic has had a significant impact on the mental health of our state's residents and communities. County governments, tribal governments, and service providers are faced with the challenge of ensuring individuals are safe, healthy, and getting necessary care and treatment. And daily we are seeing people who are experiencing greater complexity and acuity in their mental health and substance use disorder conditions and symptoms. The need and complexity is evidenced by increase in use of services at the crisis end of our continuum, such as emergency departments, law enforcement response, mental health crisis services, and civil commitment. Even when more people are vaccinated and some of the physical health risks of COVID subside, we know the mental health impact of COVID will be felt for many years to come. In terms of the county role in this process, the statute requires that counties are responsible for developing and coordinating a system of locally available and affordable mental health services. Each day, the counties, along with our system partners and tribal partners, are engaging with individuals living with mental illness and their loved ones to access care. Counties, tribal governments, and AMHIs play an important role in convening, planning, coordinating, and service delivery along the whole continuum, which ranges from prevention to early intervention, treatment, and recovery. We also, through our AMHIs, are really close to the service delivery system and can identify those emerging needs and service priorities and gaps. So again, our role is really along the continuum. Those services include education, outreach, arranging for transportation, housing, either delivering directly or making available services such as therapy, assertive community treatment, intensive residential services, crisis, case management, care coordination, peer support, medication management. And all of these services support people to live thriving lives in their community. And again, that's a very brief snapshot of a very complex system of care. Statewide, the Adult Mental Health Initiative, or AMHI funding, is critical to making this entire continuum of services available, affordable, and responsive to the needs of our residents. It funds uncompensated care and services that aren't covered by health insurance, provides support for housing, transportation, and other critical social determinants of health and well-being that allow individuals to engage in their treatment services and live in their communities. Overall, AMHI funding has been used to hold together and continue to innovate a fragile and fractured system. It's utilized to support many necessary services that otherwise would not be available or sustainable. And this network has proved absolutely critical, especially during this time of COVID. Now more than ever, counties, tribal governments, local partners need these resources at the front line to do this work. So what we're asking for today, House File 1600 starts to address this need for more resources by providing $6 million per year for the Adult Mental Health Initiative grants. Our goal is that each county and region will have adequate resources to provide a unique delivery system to those needing mental health services. We want to be able to meet the needs of all people experiencing mental health symptoms and crisis and be able to offer them the resources to engage in their recovery in their local communities. The funding provided in House File 1600 will help achieve this goal and better serve our communities. As mentioned by Representative Ryer, partnerships have been crucial during this COVID period. It will take a strong partnership between DHS, counties, health plans, regions, tribal governments, and our service providers to reach these goals. The AMHI is a proven effective collaborative structure and grant for addressing needs with innovative and community responsive approaches. So we thank Representative Ryer for her leadership on this important mental health issue, and thank you to the committee for this opportunity. With that, I'd be happy to answer any questions.
Thank you, Ms. Shug. And we'll go to the next testifier and then open it up for questions. So the next testifier is Lori Long. Ms. Long, welcome to the committee. Please state your name and affiliation for the record and then proceed with your testimony. I believe you're muted, Ms. Long. There you go.
Okay, hi. Chair, committee members, my name is Lori Long. I live in St. Cloud, and I want to talk today about my local AMHI serving Benton, Sherburne, Stearns, and Wright County in central Minnesota. A little bit about me before I got sick, just to give you a feel for where I went. I had a career of over 20 years in nonprofit management. I created programs and ran those programs. I was happy. I had a full life, and I was a vibrant participant in the community. That nonprofit work included 5 years in children's mental health. I also was a real estate agent, and also, you'll know this word, I was a flipper. I was a talk radio host on our local talk radio station. And finally, I was elected and served 2 terms, which is 8 years, on our St. Cloud City Council. Then I slowly started to get sick. I was struggling with a very private illness in the public eye. I was one sick little puppy. I was desperate, but I got an amazing Stearns County social worker who helped me get locally funded initiative services, which made a huge difference in my life. I utilized the crisis adult services, including the hotline phone number, as well as the mobile team, which came to my house and brought me to the ER, which was much needed at the time. I've also utilized the county flex funds. I've used it for things such as getting my car fixed. In addition, I was awarded a one-time registration amount of money from Stearns County to attend a workshop that was focused on those struggling with the mental health disorder. And with my skills and my experience, they felt it would be a good, spending of money. I was not included, mileage was not included, and I did have to bring back a report at that time. I've had a housing social worker who helped me stabilize my housing situation with my mortgage payments. They also provided a 1-year stipend each month, which helped me get back on track with my mortgage. Finally, I've utilized supported employment. I had a job coach who helped me find appropriate work, supported me during that process, and I'm happy to say I've been there 3 years and I couldn't be happier. Another success story. Oops. Okay. Without these services, I could have lost my home. I could have missed out on crisis services, and I likely wouldn't have a job. In addition, I saw my psychiatrist once a month, my therapist every week, my adult rehabilitative mental health worker, which is called ARMS, once a week. And finally, I got electroconvulsive therapy, which is an outpatient procedure. They give you 2 blood pressure cups, an IV, and they give you a headache preventative as well as the stuff that puts you under, which I can't think of the word. That's a symptom of mine. And then they were putting heart monitors, a couple things in my head. I laid back and it was done. Later, I read the files and found out that they're giving me basically a seizure to break apart the neurons that aren't working, and hopefully they grow back together, which in my case they did. The procedure itself was 35 to 40 seconds. I was also appointed to our local adult mental health initiative to serve on our advisory committee, as well as our decision-making joint powers board, which helped me remember that I was competent. I gained my confidence, and I realized that I was able to use my life experiences as I had before in a setting that made me feel like I really could contribute to society. I am involved for 10 years. It has been life-changing for me. One of the things that I struggle with as we work with budgets is we don't have enough money. I think the thing that I worry about the most is that there are people out there struggling who aren't getting the services they need. With our funding, our growing population has impacted the dollars we spend. We don't even get a cost of living increase. We've had the COVID, which has increased need incredibly, and we don't have the dollars to meet those needs. I urge you to please, please increase our funding for AMHIs statewide. I not only ask for myself, but for the thousands of Minnesotans who are in need of these services. Some are worried about how our dollars are spent, being as they're flexible. All unduplicated expenditures are reported to DHS, to the Minnesota Health Information Center, as well as the Social Service Information System. Our initiative itself also does auditing of different providers. And in fact, there have been times that some of our providers were not meeting those needs, and we've changed providers. The data for our community adult mental health center in central Minnesota shows that we receive $2.99 a year per capita. We need more. We need your help to increase our funding. I'm a success story. My journey has had its ups and downs, but I'm living in recovery now. I'm healthier today than I've been since I got sick, and I've been able to see that there are things that I can do and I can't do, but I've been able to compensate for those things. I even took an 8-week workshop, a professional comedy workshop, to hone my skills. I now do stand up using my very funny material from my mental health journey. It educates, and makes people comfortable enough to laugh. I also do community public speaking in my area, as well as public speaking for NAMI Minnesota to law enforcement, as well as other groups. My adult mental health initiative helped save my life, and I'm so, so grateful. I strongly encourage you to increase our funding. We can help so many more people struggling to live with mental illness. Thank you, Chair, committee members, and Representative Ryer for authoring this bill. And thank you for listening to my story.
Thank you, Ms. Long, for that testimony and sharing your story with our committee. Really appreciate it and all the work you're doing advocating for increased funding.
Thank you.
And also, I'm hearing some feedback. Okay, I think it's resolved. But anyway, thank you also for, talking about your experience in making mental health issues more public so others feel comfortable seeking help and treatment. We'll go to questions. I'm seeing Representative Rasmussen.
Thank you, Madam Chair, and thank you, Representative Ryer, for bringing this bill today. And also thank you for the testifiers. Ms. Long, I hope I get a chance to hear your stand-up comedy at some point, so thank you for sharing your story. I just wanted to share a little impact story from Otter Tail County that I've heard, I think just underscores some of the importance of this funding. We have a nonprofit provider in Fergus Falls that receives about $100,000 per year in AMHI funding. And just this last year in 2020, even with everything going on with COVID, they were able to serve 154 job seekers that struggle with serious mental illness and serious and persistent mental illness. And they were actually able to help 77 individuals find new jobs. And so I just want to underscore the importance of this funding, and thank you, Representative Ryer, for bringing this bill today. The question I had is, I know the governor's initial budget, I believe, made cuts to these grant proposals. And so I don't know if anyone from DHS would be available to respond to that and just confirm that. And I would just pass along the feedback that I hope the governor reconsiders that as he puts together his updated budget, given the important success stories that we've heard here today.
Thank you, Representative Rasmussen. And you can find on the budget change sheets, the realignment of these mental health grants in the governor's original budget. I hope too that we see a change in the supplemental now that we don't have the large deficit. And we'll bring DHS forward later if more members have questions about that. Representative Rasmussen. Representative
Excuse me,
Robbins. Go ahead, Representative Ryer.
Yeah, if I may, I have data about the underspending, and so I think I could answer that at least at a high level. The main fund, which is like about 35 million, was spent to 99.48% of the grant was spent. There are a couple of small categories that total less than $1.5 million, where one that was $23,000 was at zero. One that was about $835,000 was at 64%. But the large fund was fully spent. I think that, and I hope too that the governor will reconsider, because the data do show that spending was strong, and this was fully and well used and a great resource for all the communities it served.
Thank you, Representative Ryer, for that information. Representative Robbins.
Thank you, Madam Chair, and thank you, Representative Ryer, and your testifiers, especially Ms. Long. Really appreciate you taking the time to share your story with us, and congratulations on your great success and how you are using it to help other people. It's super inspiring, so thank you. I had a question for Ms. Ryer or the testifier from DHS. So I looked at the bill and it's very short. 3 lines saying $6 million in each fiscal year for DHS. And the underlying research we got said that there's going to be $300,000 a year for mental and health and culturally specific services, $1 million for the mental health initiative, $4.55 million for housing support grants. And so I just wondered if you could explain where those numbers come from and why it's not in the statute. And I'm particularly, we do a lot with housing supports, which I'm really glad about, but how do you square putting most of the money towards the housing supports and only $1 million per year into these mental health initiatives?
Representative Ryer?
Yes, thank you, Madam Chair, and thank you, Representative Robbins. I'm going to have to go into the realm of the assumptions that I've been making, and what I've heard is that, some of this is direct about housing, but there are many, many programs, as you pointed out, and there are many gaps amongst the programs, and the gaps are different from place to place across the state. So when you see funds allocated to these different types of services, my expectation for this bill and for this increase is that we'll be able to have even more mortar to connect the pieces. And then that's why you would see them allocated out to different types of services. And I would defer to Ms. Shug about that if there's anything to add from the Deputy Director from the county perspective.
Ms. Shug?
Madam Chair, Representative Ryer, I would just reinforce what you said in terms of the work of the adult mental health initiatives is really to do that look at a regional level to identify the gaps and needs, and to always be looking for the services that are available and using those first, and then using these AMHI funds to fill in those remaining gaps and needs. So certainly as other housing supports and resources are available in a local community, those would be used, and then this funding would be used to fund various gaps and needs that continue to exist in the continuum. But it's very powerful to have that planning happen at the regional level to be able to be really responsive to the individual community's needs and resources and strengths, and bringing that voice of many different partners to the table to help inform that decision-making process, including that voice of lived experience, which Ms. Long has so thoughtfully shared today.
Thank you, Ms. Shug. Representative Robbins?
Thank you, Madam Chair.
Oh, you're muted.
I'm still not 100% comfortable with why none of that is in statute, and also I just wondered, everyone keeps saying that it's just all this funding is distributed regionally. Will it go to existing pilot projects that are out there, because that's not specified in the bill, or will it go to new ones? And is it a certain amount per county, or is it based on population? How is it distributed regionally?
Representative Ryer, do you want me to hand this to DHS?
Absolutely. Please, thank you.
Who from DHS? Mr. Burdick?
Thank you, Madam Chair. For the record, Matt Burdick with the Department of Human Services. To your question, Representative Robbins, so the statute that is cross-referenced in the bill, 245.4661, outlines all the various types of services that this funding can be spent on. And as Ms. Shug talked about, the way this is allocated is that the various regions, these adult mental health initiatives, they do a needs assessment of their local needs, and then they submit a plan to DHS. The current way the funding formula works is based on some historical information from when these were first created, and we've been working collaboratively with the counties on updating that, but that's a future problem. So with this funding, we would look at our current distributions that go to the various AMHIs and then distribute whatever available funding is appropriated by the legislature proportionally using our existing allocations.
Thank you, Mr. Burdick. Representative Robbins?
Thank you.
Representative Albright?
Thank you, Madam Chair. Good morning to everyone. Representative Breyer, thank you for bringing this bill forward. I'm reminded of a visit that we participated in at the Zumbro Valley Mental Health Pilot a few years ago, and just how impressed I was with the emphasis on the care that was provided to the residents there. I do note that in the bill, a little over $4.5 million is appropriated for housing support grants, and with Mr. Burdick's explanation, part of it, my question was answered by his response. I'm wondering if you could parlay that in terms of, it's an open-ended question, but what does that really buy us? And welcome your response to that question.
Representative Breyer.
I'd like to defer again to Mr. Burdick, please, Madam Chair.
Mr. Burdick.
Thank you, Madam Chair. I would actually defer that to our county partners. As I said, they're the ones that really develop the plan for their region. And so each, the way this is going to look in each AMHI is really going to be different based on the needs assessment of that local community. And that might change year to year based as those needs evolve. So I'd defer to Ms. Shug on that.
Ms. Shug.
Madam Chair, I would say that as Matt said, the needs would be determined by that local needs assessment. And then as was referenced, that plan for addressing those needs is approved by DHS. And then that the services that are delivered have a reporting component where we're reporting out based on the type of service, the number of people that we're serving, the impact of that service. So depending on the service, the number of people served or the types of services that would be delivered would be different, but based on the local needs. But that information would be then put into our system so that we can report on that by region.
Thank you, Ms. Shug. And members, in your portfolio of documents also posted on our website, there are 2 good documents that talk about the list of potential services that counties may provide and use these funds. So I would encourage you to look through those 2 documents. Representative Albright.
Thank you, Madam Chair. Just a final follow-up for whomever wants to ping pong this one. Is there a cap on each grant afforded based upon the applications brought in, or is it on a first come, first served basis? And I'll conclude with that.
Mr. Burdick.
Thank you, Madam Chair. Representative Albright, there is a specific allocation that goes to each of the 19 AMHIs. And that's based on the total pot of money available. So if this bill were to expand the available funding, each AMHI's allocation would increase proportionally, but each region does have a discrete set of funding. It's not a forecasted entitlement.
Thank you, Mr. Burdick. Representative Liebling.
All right, well, thank you. Well, like everyone else, I add my thanks to Ms. Long. Very congratulations on your recovery and your efforts, and thanks for your testimony today. So a couple things. I had wanted to ask a similar question to what's been asked, kind of how you arrived at the request amount. And I guess Ms. Shug is probably, I would just maybe ask her if she can respond. And kind of along with that is whether that's a scalable amount of money. So if we have less available, but we're able to do something, is that also helpful? I'm kind of assuming that the answer is yes, but just wanted to get a sense of how you arrived at the number that you've got before us. And I've been looking at the statute here while I've been waiting, and if any of you care to do that, it's very instructive and kind of answers some of these questions. It has a list of potential services in it. You know, I mean, I think this is really important stuff we're doing here. I also, before we go to the answer to my question, I just wanted to also make a comment about, there was a comment before about the governor cutting the budget. And you know, I just want to say that the governor has the disadvantage of having to go first. And just so everybody's really clear, when the governor put forward his initial budget, he had to deal with a budget deficit. And so when you have a budget deficit, which is you know, that you have to put forward a budget that meets the deficit. You have to make some very hard choices. So, you know, some of the choices that were made in the initial budget were ones that nobody wanted to make, but you have to meet your responsibilities under the law also. So I just want to put that out there, that we are extremely fortunate that we're not in a budget deficit situation now. However, there are always trade-offs. So, you know, it's especially for members who haven't been through this process before, it's really easy to say, oh, you know, why are you not wanting to do this other thing? We'll see if members are willing to, you know, I've observed over my years in the legislature that a lot of members want to spend the money, but are not willing to raise it. So, you know, I think we would behoove us all to, you know, focus on the issues before us here and which things are going to merit our limited resources, because our resources are always going to be very limited considering what the needs and the requests are. So just wanted to put that out there, but I would really like to hear kind of what's behind the number that's been requested.
Thank you, Chair Liebling. Ms. Shug, do you have the answer to why 6 million and whether this is scalable?
Madam Chair, I would defer to Representative Ryer for information on the total amount, but what I would say is, as we've described, the needs are great right now and the unmet needs are great. And already the mental health system is incredibly stressed, and even prior to COVID, really struggles to meet all of the needs that we see in our communities. And so I think that, you know, any amount of funding is important in terms of increasing and our ability to meet that response. But in terms of the overall figure that's in the bill, I would defer to Representative Ryer for that.
Representative Ryer?
I think the term was either popcorn or, thank you, Madam Chair, the term was either popcorn or ping pong. And from my point of view, I'll answer the second part. The amount certainly is scalable. Anything that we are able to provide for these important services will be helpful. And perhaps DHS can speak to the amount. I would just, again, speculate that it's driven by a needs assessment, as I've found them to be thoughtful in the figures they bring forward, but I can't speak to its exact creation.
Mr. Burdick?
Madam Chair, I don't know that we can speak to the amount requested in this bill. This is not something we've brought forward, so I'd defer to the counties on that.
Okay, well, I will say that we're hoping to get federal money from the stimulus bill for behavioral health and mental health issues. So it could be hopefully leveraging federal funds for these programs. Okay, Chair Liebling, did you have a follow-up?
No, that's great. Thank you, Madam Chair.
Representative Sandell.
Thank you, Madam Chair and Representative Ryer. I certainly support the bill and recognize the enormous importance of mental health and counseling, not only during these days, but through our lives. But I am concerned about the absence, or maybe the less support than we might get through private health plans, whether it's Health Partners or Alina or Blue Cross Blue Shield. Maybe Representative Ryer or perhaps Ms. Sugar could talk about the relationship between those private plans and the county, and when the county can depend on, or when an individual can depend on their private plan, and when they have to go to the county for help.
Ms. Sugar?
Thank you, Madam Chair. Representative Sandell. We, as the health plans, are an important partner within our adult mental health initiative continuum and partnership, and very much are at the table to work with us in terms of addressing the needs of people in our communities. I think one of the things that it's important to point out in terms of how these funds are used to address gaps in needs is that they really fill a gap in terms of a lot of services in our continuum that aren't funded through healthcare services, that don't fall within that kind of healthcare benefit set and aren't traditionally reimbursable through those sources. So for example, outreach activities and education and, you know, those services that often really support a person to access those services that will eventually be a service that's funded through their health plan are really important kind of needs and gaps that this particular funding is really important in addressing. So certainly the health plans are at the table, are great partners, are working with us on these issues. But in terms of kind of their role in funding some of these services, this is really part of what is really important about these more flexible funds to be able to fill some of those gaps that aren't part of the health plan benefit set, but are a really important part of getting people to those services. We know that it's an incredibly complex system that people are navigating, and the services that of the AMHI help people to bridge to those other services such as health plan services. Thank you.
Thank you, Ms. Shug. Representative Sandell?
Thank you. As I listened to Ms. Long's testimony, I recognized that there were some activities and some services that were provided for her that might have come from health plans, but I do recognize how important some of the other services that she was able to access and have been important in her life. So thank you very much. Thank you, Representative Ryer. Nice job.
Thank you.
Thank you. It looks like Mr. Freeman wants to contribute. Go ahead.
Yeah,
Introduce yourself to the committee, please.
Thank you, Madam Chair. Matt Freeman, Executive Director at MAXA. To answer the question about where that number, that 6 million came from, as MAXA had discussions about investments in the AMHI regional block grants, the amount we came to is about $1 per person, or 20% of the current grant allocation. And so that number came about to that $6 million figure. So that's where that number came from. Again, we would be supportive of increased dollars of a different amount, but we felt that was an appropriate balance of being able to expand those dollars and still prioritize and use them most effectively.
Thank you, Mr. Freeman. And were you here just to answer questions, or did you need to testify as well?
I am testifying on a later bill, Madam Chair.
Okay.
So I just wanted to offer, since I was here and able to answer the question.
Okay, thank you, Mr. Freeman. We have Elizabeth Emerson. I'm not sure if you were here to testify or to answer questions on this bill. Are you with us?
Madam Chair, I believe she was here to answer questions as well.
Okay, thank you, Mr. Freeman. Okay, I'm not seeing any other questions. So members, House File 1600 will be laid over for possible inclusion. Ms. Representative Ryer, do you have a quick closing comment?
Just very quickly, I want to advocate once more for the value of this funding to help pull the pieces together so that each region of the state across our state can have their unique needs met and all of our people can be sufficiently cared for. Thank you.
Thank you, Representative Ryer, and thank you, testifiers, for this bill. Appreciate it. So again, members, this bill will be laid over for possible inclusion.